Hello, I am Dr. Leslie, and I want to welcome you to another episode of 2-Minute Emergency. I am your host, board certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these messages to teach you about how to stay healthy, safe, and out of the emergency department. So what is my topic for today? Well, as many of you already know, October is Breast Cancer Awareness Month, and I would be remiss if I did not have a segment addressing this illness. So let me start off by saying that you probably didn't know this fact, and I wasn't even thinking about it myself until I did a little bit of research. 1 out of every 8 women, 1 out of every 8 women in the U.S. will be diagnosed with breast cancer at some point in their lives. That is an astounding number that I didn't even realize. So let's talk a little bit about breast cancer. So it's the most common cause of cancer in women outside of skin cancer. And the common age is anywhere from 40s up to 60s. Now, I said average age, not necessarily the case, as you will find out. So in 2021, 281,550 new cases of invasive breast cancer will be diagnosed. That's just in the United States. And breast cancer is the #1 type of cancer in women throughout the world. Out of those numbers, there are likely to be 49,000 new cases of non-invasive breast cancer, which is also called in situ cancer, diagnosed just in the United States. What that comes down to is literally, on average, every 2 minutes, yes, every 2 minutes, a woman in the United States is diagnosed with breast cancer. Just amazing fact. Also, I'm going to talk a little bit about survival here. So, of the diagnoses, 63% are diagnosed at a localized stage. That means the cancer hasn't spread anywhere. It's exactly where it started. And the 5-year survival rate for those that are diagnosed in situ is 99%. So we have a simple answer. Not a cure, not a prevention, but an answer. So I'm going to go into that a little bit later as well. So that is literally 3.8 million breast cancer survivors in the United States right now. 3.8 million. There was a time many years ago where if you had breast cancer, that meant death. That's no longer the case. It's not an automatic sentence. There are things we can do in order to discover it, as well as treatment plans for it. So there are 3 main types of breast cancer. Now, there are many different types, but I'm going to start off with one of the most common, which is called ductal carcinoma. And the ductal carcinoma means that the cancer is in the duct leading from the glands to the nipple. All right? And that is most often the earliest form. It hasn't spread outside of that area, and it's usually found through mammograms. I think I have to stop here and talk a little bit about mammograms. So mammograms are generally recommended to start for women in America at age 45, and they should be done every single year. Every year. Once you reach the age of 55, they can be spread out every other year. Now, that being said, there are certain cases where it should be done earlier. If you have a family history of breast cancer, your doctor may want to start that earlier. If you've ever in the past been diagnosed with having abnormal cells on your mammogram or abnormal changes in your breast, your doctor may want to start that earlier. So there's a lot of other things that can cause your doctor to want to start your mammograms earlier. So I'm going to talk a little bit about mammograms. Getting a mammogram. What is mammogram? Well, it is a low-dose X-ray where it's literally a 3-dimensional image is constructed of your breast. in order to see if there's any changes. Specifically, they're looking for calcifications or densities in your breast. And that can be indicative of possible cancer. Doesn't always necessarily mean it's so. There are other tests that they want to do after that initial mammogram. American Cancer Society, as I said, recommends that it starts at age 45. And keep in mind, when I'm talking about breast cancer, I'm speaking about women, but it's not always women. Men can also be diagnosed with breast cancer. And many times it's found later than women because nobody's thinking about it. We have to think about our men as well. So what happens when they see something? So first of all, when you're looking to have a mammogram done, make sure you're going to an FDA-approved site. There are many places. There are mobile vans that I've seen that do mammograms. There are clinics, all sorts of places that you can go, but just make sure that they're FDA certified. When you schedule your mammogram, you want to schedule it a week after your period. That's the ideal time. It's not because it gives them a better image. It's because it's less painful for you. When they're doing a mammogram, they're literally compressing your breast, which is necessary. There's no getting around it. It's necessary in order to get a good image. You want to make sure you don't wear certain things. So ideally, you want to wear a two-piece outfit, whatever you're wearing, so that you don't have to remove all of your garments, but you have to remove your top and your bra. The other thing you want to keep in mind is not to wear any deodorants, lotions, antiperspirants, anything like that that's going to be on your skin. Obviously, having bathed, nothing goes on afterward because you don't want to have anything that could possibly give an artifact. That's what we call them, artifact or an anomaly on that mammogram and make them think, oh, there could be something going on when it's just something that you have on your skin. So keep that in mind always. The time it takes for a mammogram is about 20 minutes. So that's what you can expect. So I'm going to get back to a little bit more about that in a moment, but I'm going to go back to the types of carcinomas. So for the ductal carcinoma, which I was mentioning earlier, there are treatments for it. Now, sometimes it may require what's called a lumpectomy, which is just taking the tissue, the affected tissue itself, and some areas of healthy tissue around it because they want to make sure that they get the whole area, and that's called a lumpectomy. Other times they want to remove the entire breast, and that is to prevent anything from expanding, all right? So, and that's called a mastectomy. Now, typically for ductal carcinoma, there aren't symptoms. These are found on mammograms, hence the importance of getting that mammogram done. Now, there are sometimes where you have symptoms, and they generally will include something like a bloody discharge from your nipple, or they may include you actually feeling the lump. And that's something else I need to mention is making sure that you are doing your breast exam, your self-breast exam, which you should be doing every month. And I'm going to see if I can post somewhere where you can have information on how to do your own self-breast exam. Actually, I'm going to put that on my YouTube channel, and I'll also put it as a Facebook post later on, so you'll be able to come back and take a look at that. And so, in addition, what happens is that ductal carcinoma, which doesn't often spread but can become invasive. Once it becomes invasive, that makes up 70 to 80% of all breast cancers. All right, so it starts out as ductal and then spreads to become invasive ductal carcinoma. Now, the second type of breast cancer that we worry about is inflammatory breast cancer. This is typically someone who presents with a breast that is swollen, red, tender, sometimes hot to the touch. And we often think of it, well, most likely it's just what we call mastitis or a localized inflammation of the breast. Now, this develops over weeks. So the first thing your doctor is typically going to do is treat you with an antibiotic for a presumed infection. Here's the key. If you're taking that antibiotic as prescribed and it does not improve, you know that there is an additional issue that has to be addressed, and you must go back to your physician so your physician can order additional testing for you. All right. Very, very important. And so some of the changes you may see is, in addition, is discoloration. I didn't mention that, as if it's bruised. You may also notice that you have increased lymph nodes underneath the arm on that side. Now keep in mind, this typically is just one breast, not both at the same time. The other thing you can see is a flattening or inward turning of the nipple. And you may also see some skin changes where the skin becomes thicker than usual, and it gets the appearance almost as if it looks like an orange peel. Okay, we call that peau d'orange after the French because it literally looks like a orange peel. Risk factors for that type of cancer are females, obviously, as well as age 40 to 50. So this is a little bit younger than many of the other breast cancers that we see. Another risk factor or high risk factor is African American women and obesity. So we've got to keep those in mind. Now, the one that we hear about most often is something that is, as I said, not the most common, but the most aggressive form of breast cancer. And that's called the triple negative breast cancer. Why is it called triple negative? So it's called triple negative because it doesn't have many of the receptors that we normally have on breast cancer. So it does not have your estrogen receptor, progesterone receptor, or what's called a HER2 receptor. So the estrogen and progesterone, let me say a little bit about those. Those are two main hormones in the female body, and they're produced by the ovaries. They're responsible for our female development, as well as the reproductive development and fertility. So that's what we think of when we think of estrogen and progesterone. Now the HER2, it's still produced, I have to stand corrected. There are still HER2 receptors in triple negative breast cancer. However, there are fewer produced than normal, significantly less. And the HER2 is a growth hormone protein, or growth promoting protein on the outside of the breast cells. The reason these receptors are so important because they allow a target for treatment. So if you're missing many of the targets, it's a lot harder to treat. The 5-year survival rate varies for this type of breast cancer depending on the stage in which it was found. So the stage is whether it's localized, whether it's regional, or whether it's distant. And that's going to definitely affect the projected lifespan. Now, I'm going to go back a little bit to mammograms because there's something important I want you to know. So we think about October, we think about Breast Cancer Awareness Month, and we think about getting our mammograms done. There may be people out there who say, well, I don't have health insurance or I can't afford to have a mammogram done. Let me tell you something. Medicare and almost all private insurance companies cover annual mammograms without a copay and without any out-of-pocket cost. All right? Medicaid also covers mammograms. Now, there are those people that fall in the category of low income or they're underinsured or uninsured. For these individuals, there is a free and low out-of-pocket program available. I'm going to put a number in here so that you can see exactly the number that I would love for you to call if you fall in that group and you want to make sure that you are tested to make sure there's no chance of cancer for you at this time. This is the number for you to call. There we go. Oh, I'm going to hide that other one. Okay, this is the number for you to call, and that is to find out where you can go in your area to get a mammogram. That's 1-800-227-2345. So I hope you found this information helpful. I want you, as I always say, to stay healthy, safe, and out of the emergency department. And for something like breast cancer, which we know as such a high prevalence, early detection is going to make all of the difference. I myself have 2 friends currently that have recently been diagnosed and are under treatment for breast cancer. It's everywhere. I'm sure if you are in the age anywhere between 40s and 60s, you know someone or know of someone who has also been afflicted with breast cancer. But survivors are out there. And so early detection treatment leads to survivors. Once again, I am Dr. Leslie, board certified emergency physician, best-selling author, international speaker, and professional photographer. And for more information, or if you want to find out about any of my other episodes, please go to my YouTube channel. You can type in Dr. Leslie Sharp, and you will find information there. Or you can find me on Facebook at any time. Once again, Dr. Leslie Sharp. So I want you to stay healthy, safe, out of the emergency department, and I will see you soon. Take care for now.